You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have Michigan's go-to dental implant dentist, Dr. James Reznich. Dr. Reznich, welcome to the program.
Thank you so much for the kind words, Randy.
Sure. That's great. Now, I know you brought a stack of photos, so we'll get to as many of those as possible.
I did.
Now, before we get started, for people that don't know your practice,
right,
like who's the typical implant patient that comes in?
Randy, there's really two kinds. People that have really bad teeth, maybe they're heading for dentures. So the teeth are crooked, they're broken, maybe their gums bleed, they're coming from gum disease, so an infection in the gum, or maybe they've had decay all their life, and they may or may not have a lot of dentistry throughout the years. Sometimes it's dental work after dental work, so really it's kind of a sad story when decay leads to a small filling, and unless you stop the decay, it will lead to a bigger filling. Well, that's the second one. Now there's a third filling. Okay, cuts the tooth in half. After the tooth is cut in half, now a point breaks off, so we all know what happens next. You need a crown. Well, once the crown is done, down the road is a root canal. We've all had that.
Yeah.
Have you, Randy?
No, but...
Well, you're a lucky guy. I have, and I just lost the tooth, but another story. But then after the root canal, don't worry, this is what comes to dental implants. So those are the people that are suffering despite the dentistry.
So they actually go to you because they're trying to avoid a denture.
They
want their teeth
They
back
want to avoid a denture. But one thing that's really special about us, Randy, is that before you go to a denture, before you go to implants, there may be things you can do to save your teeth. So it's not everybody that has to go to a full mouth reconstruction with dentures and dental implants, held in by dental implants.
Okay.
There may be things we can do before that happens.
All right.
And that's one thing. The other type of patient are the denture wearers, and they're the ones whose teeth are loose and ill-fitting, and sometimes actually after you've worn a denture for long enough, it's the teeth and function and chewing on the teeth that keeps the jawbone there. When you take those out, the bone goes away, so the dentures don't fit. If you've been wearing lower dentures long enough, they'll start to hurt when you chew because there's a nerve there. There's a nerve there that starts to get pinched when enough bone goes away. So with those patients, it's giving them their life back and their chewing back, their smile back. And it really can change their lives, and I've seen it over and over. So for those people that are wearing the denture, we can give them their smile back. We can give them teeth back, Randy. Teeth that they can chew with, teeth that they can smile with, laugh out loud. These people really, humans are an amazing thing. They can adapt to just about anything. So it's really, when you become a denture wearer over time, you don't realize that your function is slowed down. You're doing less and less.
As well.
You can't eat as well. It used to be, well, let's go back to maybe when you're losing a tooth or two, or that one sore tooth. What happens when you get a toothache, Randy? You chew on the other side. You can't, and if you let it go long enough, because a lot of people, let's be honest, don't go to the dentist at the first signs of
That's
need.
for sure.
Okay, a lot
Nobody
of them
likes
don't.
going to the dentist.
No, nobody likes it, but that changes their life. All of a sudden, you can't chew on that side, or it hurts to chew there. So now you're functioning a different way. Well, let's just keep going down that road until all your teeth are out. And now all of a sudden, you don't realize that you can't bite into a corn on the cob. You can't, chew a piece of steak. You can't. So many things you can't do. Just speaking and laughing out loud. Or let's go to a restaurant with our friends, and what are you going to order off the menu? Something that you can eat and chew that's not going to embarrass you.
Is that what the denture wearers tell you?
That's what the denture wearers have to do.
So I'm clear. So if a denture wearer, they can go in and get a full set of teeth that snap in, snap out,
right?
Or they can get a full arch of teeth that are just locked in, that don't come out.
Yeah, absolutely,
Is that right?
Absolutely. So especially for the upper, I mean, if you want to taste food, if you want to go back and if you want to remember I had a cup this morning, a cup of coffee with a little cream really tastes like. Okay, you have to feel on the roof of your mouth the warmth of the coffee. That's part of where taste comes from.
And the denture wearers.
Denture wearer doesn't have that.
Okay.
Denture wearer, and a denture wearer also, Randy, there's a strength that comes with having the tooth. So your body knows it's a fascinating thing, but you can't get the force in chewing with a denture that's loose, your body is protecting itself. So once you attach those again, whether they're snapped in or attached fully, now you can bite through things that you could not bite through before. You're gonna be able to. And people, like, how many times would you really want to bite through an apple? Okay, and use your front teeth and tear it. All right.
And they could do that.
They can do that with no problem.
So it's like getting your teeth back in a way.
It is getting your teeth back, Randy. It's not like it.
Okay.
It is getting it back.
Now, where you are there a lot of people wearing a denture or headed to dentures?
Yeah, Randy. You know, you wouldn't know it walking down the street, but they're really everywhere. All right. So
like thousands?
More than thousands, Randy. I mean, half the population doesn't even go to the dentist. Okay. And yeah, just for openers. And they may have had a bad experience. I mean, there are many of those that have waited a long time. Or maybe, again, dentistry has changed remarkably since I've been practicing. So I've been practicing 32 years, but we just didn't have, even dental implants, Randy, they didn't really exist when I started practicing the way they do now.
So if dental implants are so good, especially for stabilizing a denture for the denture crowd,
Yeah.
why aren't they all doing it?
Yeah.
Why aren't they coming in?
Well, yeah, Randy, I think they really, first, they just don't know what's available. When you're wearing a denture, you really have no reason to go to the dentist.
Okay.
I mean, maybe it's about a sore spot, or you know that the bone is going away and they're not fitting properly, so they'll come and typically they'll be offered a reline and off they'll go. They're just not aware of what their options are.
Okay.
Some, I mean, and it's a really valid reason. I mean, dentistry has already not done them any good. Like we were saying before, I mean, they've had filling after crown, treatment after treatment, fixed bridges, just all kinds of dental work at all kinds of expense. And really, expense comes in money, time, and stomach
And then
lining.
they lost all their teeth.
And then they lost all their teeth. And so why would any sane person?
They don't want to go back to you.
They don't want to go back.
Do you still hear it like, no offense, doctor, but I don't like the dentist?
Every day, Randy.
They do?
Every day.
Do they have a creative ways of saying it? Or?
Oh gosh. Well, I mean, it's actually mostly cliches. They'd rather have a baby. Just just think of something that is terrible. Okay.
Do you have a funny comeback?
I'd rather
after all
have
these years?
No, actually, I take that kind of seriously, to be honest with you.
Good.
Just because there's something behind that. Something really went wrong, and it often keeps people away for a really long time. But what part of my practice is helping these people understand what their choices are and helping them make the right choice for themselves. And of course, we have every advanced technology to help calm their nerves, help calm their...
So sedation, most of these
Absolutely.
people... Really?
Yeah, absolutely. So IV sedation just means that you'll still be conscious. I want you to in a sense, obviously you've got to clear your throat and breathe, but you will have no memory of what we've
very little memory.
Very little memory of what we've done that day, if at all, except for the smile that you left with and the chewing that you get.
Okay, good. And now, how old can you be to get dental implants? Like if you're either a denture wearer or they can't save your teeth and you need something. I mean, how old?
Sure. So, I mean, age is really not a limiting factor anymore. As a matter of fact, that's kind of what I'm saying, Randy. Just about anybody is a candidate. If you can make it to the office, and really, in a way, that's people that are healthy enough to get in. And of course, there's again, without getting too deep into medical background screening, we just make sure that they can they're prepared in a way that allows them to have what we.
So, what's the oldest patient you've ever done dental implants on?
Yeah, my oldest is an 84-year-old Randy, a gentleman. Came in with really terrible teeth, actually, and was on his way to a denture. And again, for this gentleman, money was no option. That's the case sometimes. But, and it was actually his girlfriend that sent him in. Okay, so here's an 84-year-old girlfriend sending him in because she didn't like the way his teeth were. And we did 7 implants. We attached the teeth. They don't come out top and bottom, on dental implants. So we gave him a new set of teeth. In my experience, 84.
And he could eat whatever he wants?
Whatever he wants.
Even at that age, you have to be careful? Or you could bite into things, like even with your front teeth?
Yeah, I mean, from sweet corn to apples to beef jerky. I don't know about beef jerky, but he can certainly eat a steak. But whatever he wants is absolutely true.
Is this one of those things where, it's all done, he says, I should have done this a long time ago?
Randy, interesting, most people, almost everybody says, I don't know why I waited so long. That's pretty universal. Just because, I mean, again, we're talking about dentistry. People really don't want this. I'm clear on that. Okay. They really don't. But when it's done, when they actually go through the process, when it's finished and they see their smile, and then their life starts again at that point.
Nice.
Right? And I mean, that's really, in a way, is what keeps me going. I mean,
how
I love
long
that
have you been
moment.
doing dental implants?
15 years, Randy.
15 years.
Sure.
And now we should mention, I mean, because you are like a continuing education guy. Like you say, I mean, all the time. Is there that much to learn about dental implants?
Gosh, in fact,
You travel all over the country.
all over the country, pretty routinely. I mean, throughout my whole career, I've just sought out, and I've made a point of it. My father was an educator, Randy, and the way I became a dentist was, son, be a and I was 10 years old at the time, by the way, but his answer to, Dad, what do you think I should do, was be a professional, that way you have to study for the rest of your life. And so I've made a point of seeking out the best in every field. So I've studied implants with Carl Misch and a guy named Hamle Wang.
Are these well-known guys in your business? If everybody knows who they are?
If a dentist didn't know who these guys were.
Okay, so you trained under these guys?
Yes, I have. Absolutely. Okay. And many others. And in fact, Randy, I'm signed up for another course this year down at LSU. So I live in northern Michigan. I'm headed to Louisiana for a continuum on pain and head and neck pain and bites. And so it continues.
Now, we should mention in your practice, I guess how dental implants are normally done is you go to one place that does the imaging. You go to another place that does the surgery, another dentist that puts the teeth on top. You send it out to a lab. You have everything right there, like your own lab.
Right.
Aside from convenience, what's the benefit to the patient?
Well, convenience is no little thing, Randy. Having it all there and being able to control it is really important. So, you know, when dental implants first started, basically they were put in by oral surgeons, and the surgeons weren't involved in putting the teeth on. Well, I'm really clear, Randy, I have not met one patient yet that really wants a dental implant. What they want is a beautiful smile, they want to chew, they want their life back. So that I found that, and that's really what prompted me to study dental implants, is that I had to have the foundation in a place where you could put beautiful teeth on. So that's where that came from.
So you do both parts?
I do both parts, and for even more, the artisans that make the final teeth work right in my practice with me.
Is that right?
So when they're painting on the grooves, and they're, you know, if you look at a tooth, Randy, people think teeth are white, but they're many colors, and you know, there's an inside the tooth and there's an outside, and so you really have to paint this on and have artisans. And then I mean, everybody's seen a bad pair of dentures, and you know it coming down the street.
Yeah.
My goal is never to have a patient say, oh, you have a great dentist. I want them to say, you've got a really great smile. Okay, that's really where it comes from.
Does it cost more to go to a guy like you that's doing both parts?
Right. No, it really doesn't have to cost more at all. I mean, some places you go, it's an all or nothing proposition. They're going to take out all your teeth, put in the implants, and that's all they do. Well, there's nothing wrong with that, Randy, except that not everybody can afford that full mouth set of implants. And so there are other options. So if you're wearing a poor denture, 2 snaps can be placed in, and now your denture snaps in, and it's not loose and wandering around anymore.
All right.
Maybe you have some teeth that don't necessarily have to go, and now we can use those as foundations. So there are combinations, and there are many different ways to solve those problems. That's what we're really particularly expert at.
So you say for many of these people, it is life-changing. Really?
Yeah. Well, let me show you what I'm talking about, Randy. I would just start with Richard here. Take a look.
All right.
So I was saying, as far as people that are staying away from the dentist, here's a classic example. What you can see at the beginning, he really doesn't know how to smile because he doesn't smile. He's a grandfather, and one thing that he said to me is his grandchildren really think that he's a grouch, right? They don't. I mean, think about it. If Grandpa's not smiling, or then it's embarrassment. But also this gentleman in particular, you know, had a really bad experience. He's 82 years old. He had a bad experience in the military. You know, he's in the Navy, where, you know, you have to say yes, sir, to the dentist, and they do whatever they're going to do to get you ready. Well, he was terrified of the dentist, so he had been away for several years, and he just didn't know what was available. So his options on the lower, he needed a denture, but he really didn't want that. The upper, when you look at it, most guys would have just pulled them out, but there were some teeth there that were very workable. So what we did for him is give him a snap-on lower denture.
Okay.
And the upper, he's actually wearing a partial, and we saved a couple teeth. So he's got something that comes in and out on the top. And but look at the smile now, Randy. And not only that, this guy can eat whatever he wants. So, but the story that warmed my heart about him is Christmas time, he's Santa Claus for his grandchildren. And now for the first time, everybody's up on Grandpa's lap, and he's having more fun than ever, laughing out loud, and yeah, it was a really beautiful thing. So here's another patient, Randy.
All right.
So this one, Randy, in particular, was really heartbreaking for me because she had just paid a lot of money to have her mouth completely redone on her teeth. And just a few years after that, she's in my office, and there's nothing we can do to save her teeth.
That means they're what?
That means a denture or nothing. That means
they're breaking down?
The gums were bad, there's decay around them, so nothing was done to help her know how to take care of things or maintain things. So then what we did for her was give her a new set of teeth attached to implants, right? So that they're both fixed in. And we did that in a day.
This looks very natural. It looks like just like veneers.
Well, what I love about this one at the end is I had, as I do often with most patients, actually, if they can find me a picture of who they want to be again, they'll go back into their files, and she brought me this photograph of her as a young mother. So,
oh, wow.
So that, and you can see in the after photograph, I had her tilt her head a little bit, just the same way. So you can see that, and this is the consummate grandmother, okay? She's cooking for everybody. Everybody's coming to her all the time. They have a cottage on the lake, and so the families are there all the time. And now she doesn't have to worry about her teeth anymore and all the trouble she has with teeth. She's just able to fawn on everybody all the time and loves her smile. It was super important to her. So Randy, I want you to look closely at this before and after. Okay. This is, she's got a very guarded smile, and really we haven't talked about this much, but when the bite is brought back into its proper form, the pain goes from your mouth, the pain goes from your smile. You look at her eyes, okay? This is a pain-free. So, I mean, many people have problems with their jaws, and chewing is just not eating, but the jaw joints are involved too. So this is another area that we really focus on.
So the way the teeth come together.
The way the teeth come together and coordinate, how a bite coordinates. It's very important. So what we did for her was fixed her bite and her smile. So you can see in the after, she's not guarded. And actually, if you look at her, how close did we come to her as a 29-year-old young mother?
That's a great idea. Okay. You brought in the photo from when she was younger.
Yeah.
Very nice.
Well, it's something we do routinely.
So no more dentures. Like at the top of the show, I said no more traditional dentures.
Well,
you believe that?
You're looking at it right here now, Randy. This is what it looks like.
You think you could wipe it out in Michigan? No more dentures over there?
Randy, my life is not long enough if I worked every day. And that's it. There's so many people.
Do you think if they knew how good it was, the denture wearers would all come in to do this?
I believe many of them would. I mean, if they, again, you get used to your suffering. You don't know what it's like.
You say they don't even really chew, denture wearers. They're just kind of rubbing their food together? Is that right?
They can't chew because they can't have the force, and then the teeth don't fit. And if you watch the lower denture move, Randy, okay, when somebody opens their, unless they're glued in, but then that's a whole nother story. Here, let's take a tube of, adhesive. That washes out it's gross, okay? And, they do it, but they hate it, okay? So if you watch a denture move when somebody's chewing, and that's why those first two implants are so important. All of a sudden, that lower denture isn't moving around.
To do a snap in, snap out.
To snap it in.
And that's an affordable option.
That's the most affordable option to stop that lower denture from floating around. You don't need adhesive anymore. Let's go to Bruce now. Again, you can tell I love every one of these, and everyone has a great story. All right, this guy wasn't worried about his teeth, believe it or not. All right, it was his girlfriend, and Bruce is 75 years old. It was his girlfriend, Randy, that had enough. Money was no object to him. So.
Well, that's pretty bad on that before photo. Well, I mean, that's got to be unusual.
It's not unusual at all. I mean, again, but you wouldn't know it because these people aren't smiling. These people are walking around without showing. These people aren't going out. They're at home watching television. They might not even want to talk to their own family except for on the telephone. I heard that just the other day. I heard that the other day in consultation with a guy. It wasn't him that said it. It was his wife, Randy.
So his girlfriend drug him into your office in a way.
Yeah.
Said your teeth are bad, I guess. Something like that.
Please, actually, so she was a patient of mine. Please let Dr. Reznich help you.
Okay.
That was the directive.
So what were his options?
Yeah. Well, his options would have been the same as going anywhere. Like you could have taken all the teeth out, so there was no saving the teeth. So the first option would be a denture.
Okay.
Second option.
But he didn't want a denture.
He didn't want a denture, and for this gentleman in particular, money was not a problem, right?
Okay.
So it doesn't matter who it is, Randy. They're all walks of life, all kinds of people, but. So then, we could have put in 2 snaps on the top and maybe 3 on the top and 2 on the bottom and had dentures that snap in and snap out. A huge improvement over no dentures. But basically what Bruce opted for was a replacement for teeth. So they're fixed in with dental implants. They don't come out. They chew and smile and talk and work just like teeth. So he's a really huge public figure. I mean, and he's a patron of the arts in our community. And so now he's out smiling and helping. But more than that, Randy, he's also eating what he wants. And you may have caught, I said it was his girlfriend that sent him in. So I've heard stories. I don't know for sure, but. It's about the other women that are a problem now. I mean, look at the smile, Randy. Okay,
he's looking good.
So he's a romantic kind of fellow.
Okay, good.
So here, Randy, again, this one has been this case I did maybe a decade ago, but again, look at the before. She was a denture wearer from early in life, so for a really long time. And by the time I saw her, you can see the wear on the denture. The teeth are flat. She's got corners in the smile in the corners of her mouth are dark. It's really not fitting her. She can't eat, and so what we did for her was, and again, she was one who really couldn't taste her food. All right, so she had the roof of her mouth covered, and that was really her chief complaint when she came in.
Was that upper denture?
Was that upper denture? She was already wearing. There's more to the story. She had some of the earliest before there were dental implants. They had a bar you could put through your lower jaw, and she was wearing one of those. So now. When you do a partial case, when you attach something tight, the upper was really loose compared to the lower now. So that was really the problem. And she hated her upper denture. So, and again, she couldn't taste food. That was what was the problem. So what we did for Roxy, and I love this woman, is, and this was one of the first ones I did, like I say, it's over 10 years ago, of the full arch. It was even before dentures in a day even existed. But, when I put those upper teeth in, Randy, and she could feel the roof of her mouth, I mean, she literally wept at that moment. When she looked at her smile, I mean,
Is that right?
Yeah, I mean, the effect it has on people at the first glance is unbelievable. And again, what kind of return is that?
That's nice. So those are teeth that don't come in and out.
They don't come in and out. They're fixed in now.
And she can bite and eat whatever she wants.
Absolutely.
It's a nice smile. She looks happy in that after.
Well, and then look at her face. And another thing patients don't realize is that when the teeth are too narrow, look at her face again, Randy. Look at how narrow her face is at the beginning.
At the before,
so she's got that sunken in elderly look. All right. So when people lose their teeth, denture wearers.
So the teeth kind of support the face.
The teeth absolutely support the face.
Okay.
And now look at the facial support in the after
nice.
photos.
Looks very nice.
Thank you. This guy I love in particular. All right. This was an engineer. And he was referred in from another dentist. So again, because he didn't smile, if you look at his, the first photo I have is where he's not smiling. I said, Gil, show me a smile. And this is what he came up with. I said, no, Gil, smile, show me your teeth. And you can see it's really forced. He couldn't really do it. I mean, he had not done it in so long. Well, his teeth had decay, his teeth...
Like you couldn't save those teeth?
No. There was gum disease. There was an infection down in the bone. They were coming loose. That's the gaps in the front teeth that you can see in the photograph. But then again, afterward, we went through the process. And again, he opted for one that snaps in and out on the bottom and one that's fixed in on the top. So it's teeth on top that don't come out, bottom you can take in and out. And the thing I love about this guy, so I mean, we kind of became...
Looks good. I mean, that after looks good.
Thank you very much. We became friends during this. He's an engineer, right? And so he actually was making me instruments and fixing my instruments to make it easier for me to work for him.
Is that right?
Yeah, to go through the process. So a little like soldering iron that helps take out things out, when you're transferring things. It's and so yeah, he's a great guy, and now he's eating what he wants and really has no problems.
And no more denture for this guy.
Yeah, and no more denture for this guy.
Now we are out of time. But what about those people with bad gums? Like periodontal disease or gum disease,
Sure.
can they do this?
Yeah.
Will implants go in there?
Yeah,
instead?
absolutely, Randy. Those are actually the best candidates. They've still got a lot of bone left, and when you transfer those cases to dental implants, you use the good bone that's underneath, and they heal and get healthy, and they usually have more
So you
support.
clean up the gums.
You clean up the gums that allows then and the implants to heal in the bone and become part of them, just like the teeth do.
Okay, good. We're out of time, but final
Yeah.
message to the person either headed to dentures
Yes.
or people that are currently wearing a denture. When
Right.
they're in your office, what are their
Yeah.
options as far as dental implants go?
Yeah, absolutely. So what I want them to understand is that they have many options. It's not just one thing. Snapping in or tightening a denture just with a couple of implants, top and bottom, changes the nature of the denture. They can go a step further and fix the dentures in. They can go a step further than that and actually have replacement teeth that are implant supported that don't come out at all.
Okay.
So that they're, and then even Randy, I mean, we haven't given up on everybody all the time either. So there may be teeth that we can still work with if they thought they were on their way to dentures. They just don't know what's available, and that's really what we do best.
We're out of time. Final
Yeah.
message, somebody watching this,
Yeah.
maybe they have a denture, maybe they're headed to dentures, but for whatever reason they're still afraid.
Yeah.
What do you say to them?
Well, for those patients, the fearful ones in particular, Andy, I'm never too busy to say hello. I just have you come in and meet us, feel the place, know that you're going to be welcome there, and know that we'll take you through your options and help you figure out what the best thing for you is.
Okay, good. And we should mention, insurance doesn't cover this.
Right.
Medicare, Medicaid doesn't cover this.
Sure.
But you have financing.
Absolutely.
Do people finance this stuff?
Routinely, Randy, every day.
Is that right?
Every day.
And
Yeah.
you do sedation on almost all these cases?
Yeah, absolutely.
All
Yeah.
right. I want to thank you for coming to the show.
Thank you very much.
Great stuff.
Appreciate it.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.